There is a disturbing paradox happening to millions of older adults today. Their bones are strong, yet their hearts and arteries are slowly turning to stone. Many patients show perfect bone density results, with solid spines, and hips strong enough to keep them walking for decades. But when doctors examine the cardiovascular system, they often discover stiff arteries and severely calcified heart valves, where even minor events can increase the risk of stroke or heart attack. What makes this truly alarming is that these are not people who neglect their health. In fact, they are often model patients who take calcium regularly and supplement vitamin D every day to protect their bones. Their bones may be protected, but few are told that when vitamin D and calcium are used incorrectly, calcium can gradually drift into the heart and blood vessels. Vitamin D opens the gate that allows calcium to enter the bloodstream. Without proper guidance, calcium does not know where it should go, quietly turning a vitamin once considered harmless into a long-term cardiovascular risk. Arthur is 72 years old and appears to be the picture of a healthy older adult. He is mentally sharp, walks several kilometers every morning, eats a balanced diet, and follows his supplement routine carefully. For 8 straight years, Arthur took 1,000 milligrams of calcium and 2,000 international units of vitamin D every day, exactly as recommended to prevent bone loss. His results were impressive. His bone density was nearly perfect for his age, and he had never experienced a fracture or serious injury. Over time, however, subtle symptoms began to appear. Arthur noticed shortness of breath when climbing stairs and a heavy sensation in his chest during physical activity. When doctors performed an echocardiogram, they discovered severe calcification of his aortic valve. The valve had become stiff and rigid, forcing his heart to work much harder just to pump blood through his body. Arthur was shocked to learn that while his bones were strong, calcium had been quietly accumulating in his heart. Vitamin D has a very specific role in the body. It opens the gate in the intestines, allowing calcium to enter the bloodstream more efficiently from food and supplements. The problem begins once calcium is in the blood. Calcium has no built-in direction and no natural map telling it where to go. Without guidance, it can settle in places where it does not belong, including blood vessel walls, heart valves, and even the kidneys, gradually leading to dangerous calcification. This is where vitamin K2 becomes essential. Vitamin K2 acts like a traffic controller for calcium. It activates osteocalcin, a protein that pulls calcium into the bones. And it also activates matrix GLA protein, which helps prevent calcium from depositing in the heart and arteries. When vitamin K2 is present, calcium is safely directed to the bones, where it is needed. When vitamin K2 is missing, the body enters what is known as the calcium paradox, where bones become denser while blood vessels and heart valves gradually harden. This explains why some people see improved bone density while unknowingly increasing their cardiovascular risk. The most common and most dangerous mistake people make when supplementing vitamin D is taking it alone, without vitamin K2. In this situation, vitamin D still performs its job effectively by increasing the amount of calcium absorbed into the bloodstream. However, without vitamin K2 to guide it, that calcium can gradually drift away from the bones and accumulate in places where it should not be, especially in the arteries and heart valves. This process happens slowly and silently, without obvious symptoms in the early stages, which is why many people remain unaware of the risk for years. Many believe that strong bones alone are enough, but protecting bone health at the expense of cardiovascular health comes at a very high cost. This is not a flaw of vitamin D itself. It is the result of using vitamin D without its essential partner. A safer approach is to supplement vitamin D together with vitamin K2, preferably in the MK7 form, typically in the range of 100 to 200 micrograms per day. When vitamin K2 is included, calcium is more likely to reach the bones, supporting strength while reducing unwanted accumulation in the cardiovascular system. Betty is 65 years old and had recently retired when she was diagnosed with a significant vitamin D deficiency. Her blood vitamin D level was measured at 18 nanograms per milliliter, well below the recommended range. To correct this, her doctor prescribed 5,000 international units of vitamin D per day. Betty followed the instructions carefully, believing she was doing something beneficial for her bones and overall health. After about 2 weeks, however, unexpected symptoms began to appear. She noticed irregular heartbeats, sometimes fast and sometimes slow, even while resting. At night, she experienced painful calf cramps that frequently woke her from sleep. Concerned, Betty worried that she might be reacting poorly to vitamin D. When she returned for follow-up testing, the explanation became clear. Vitamin D itself was not the problem. Instead, it had revealed an underlying magnesium deficiency. As vitamin D levels increase, the body requires more magnesium to process it properly. Without enough magnesium available, the body can fall into imbalance, leading to heart rhythm changes and muscle cramps. Many people do not realize that the vitamin D they take is not active right away. To become usable, vitamin D must undergo 2 important conversion steps, first in the liver and then in the kidneys. At both of these stages, the body requires magnesium. Without sufficient magnesium, this conversion process slows down or stalls, meaning vitamin D cannot perform its intended functions no matter how high the dose may be. A simple way to understand this is to think of vitamin D as a lamp and magnesium as the light bulb inside it. You can have a high-quality lamp plugged in and ready, but without the bulb, no light will appear. In the same way, magnesium deficiency turns vitamin D into something that is present but ineffective. Even more importantly, when vitamin D is taken without enough magnesium, the body may pull magnesium from the muscles, bones, and heart in an attempt to process the vitamin. This can lead to symptoms such as irregular heart rhythms, muscle cramps, tension, sleep disturbances, and persistent fatigue. These signs are often mistaken for side effects of vitamin D, when in reality they are warning signals of magnesium deficiency. Another very common mistake people make when taking vitamin D is not getting enough magnesium at the same time. When vitamin D intake increases, the body's demand for magnesium also rises because magnesium is required to activate and process vitamin D. If magnesium levels are already low, the body is forced to draw magnesium from critical tissues such as the heart, muscles, and nervous system. Over time, this can lead to a wide range of uncomfortable symptoms. Common signs include a rapid or irregular heartbeat, nighttime leg cramps, muscle spasms, restlessness, anxiety, difficulty sleeping, and ongoing fatigue. Many people notice these symptoms shortly after starting vitamin D and assume the supplement itself is causing harm, so they stop taking it. In reality, vitamin D is often revealing an underlying magnesium deficiency rather than creating a new problem. A safer approach is to ensure adequate magnesium intake whenever vitamin D is supplemented. For most adults, this typically means about 300 to 400 milligrams of magnesium per day, preferably in well-absorbed forms such as magnesium glycinate or magnesium malate. Another mistake that often goes unnoticed is using the wrong form of vitamin D. Vitamin D exists in 2 main forms, known as vitamin D2 and vitamin D3. Although their names sound similar, their effects in the body are quite different. Vitamin D3 is the form naturally produced by the skin in response to sunlight, and it is the form the body recognizes and uses most efficiently. It raises blood vitamin D levels more effectively and helps maintain those levels over time. Vitamin D2, on the other hand, is plant-derived and is commonly used in some prescription products because it is less expensive. However, vitamin D2 is absorbed less efficiently, converted more slowly, and broken down more quickly by the body. As a result, many people take vitamin D consistently for months or even years and still see little improvement in their blood test results. This is often not due to poor adherence, but simply because the wrong form is being used. For most people, choosing vitamin D3, also known as cholecalciferol, is a more reliable and effective option. A very simple but often overlooked mistake is taking vitamin D without any dietary fat. Vitamin D is a fat-soluble vitamin, which means it cannot be absorbed properly unless fat is present in the digestive system. When vitamin D is taken with only water or black coffee on an empty stomach, much of the supplement passes through the body without being absorbed, providing little real benefit. A helpful way to think about this is to imagine vitamin D as a passenger that needs a boat to cross a river. Fat is that boat. Without it, vitamin D cannot cross the intestinal wall and enter the bloodstream. With even a small amount of fat, the body can form the transport mechanisms needed to improve absorption significantly. This does not require a large or heavy meal. Foods such as eggs, full-fat yogurt, nuts, avocado, cheese, or a small amount of olive oil are usually sufficient. Taking vitamin D with a meal that includes fat is a simple step that can greatly improve its effectiveness without increasing the dose. Another common mistake is taking vitamin D at doses that are simply too low based on outdated guidelines. Many people believe that 600 to 800 international units per day are sufficient because these numbers are often printed on supplement labels or mentioned in older recommendations. In reality, these doses were designed primarily to prevent severe deficiency, not to restore optimal vitamin D levels or support broader health, especially in older adults. For someone who is already deficient, taking a very low dose is unlikely to produce meaningful changes in blood levels. Many recent studies suggest that reaching an optimal vitamin D range often requires higher intake for a period of time, followed by adjustment based on blood testing. This approach is not about excessive dosing, but about replacing what the body lacks in a more physiologically appropriate way. Rather than guessing, the safest strategy is to measure blood vitamin D levels and adjust intake accordingly, under medical guidance when possible. After reviewing these examples and mechanisms, one key message becomes clear. Vitamin D itself is not the problem. The real issue lies in how it is commonly used. The first mistake is taking vitamin D without vitamin K2, allowing calcium to accumulate in the heart and blood vessels. The second mistake is magnesium deficiency, which prevents vitamin D from being properly activated and may lead to muscle cramps and heart rhythm changes. The third mistake is using vitamin D2 instead of vitamin D3, resulting in poor absorption and unstable blood levels. The fourth mistake is taking vitamin D without dietary fat, which significantly reduces absorption. The fifth mistake is relying on outdated low-dose recommendations that are often insufficient to restore healthy vitamin D levels. When these mistakes occur together, people may take vitamin D for years without feeling better and, in some cases, may unknowingly increase cardiovascular risk. Understanding these 5 points is essential to using vitamin D safely and effectively. The most important takeaway is this: vitamin D should not be taken alone. To provide real benefits and reduce long-term risks, vitamin D must be used with the right combination, the right dose, and the right method. For most adults, especially those over 60, this means using vitamin D3 together with vitamin K2 in the MK7 form, ensuring adequate magnesium intake, and taking vitamin D with a meal that contains fat. When these elements are in place, vitamin D can be absorbed properly, activated efficiently, and help guide calcium to the bones rather than allowing it to accumulate in the cardiovascular system. Dosage also matters. Individuals with low vitamin D levels often require higher intake for a period of time, followed by adjustment based on blood testing. Guessing is not the goal. Measuring and adjusting is. When vitamin D is supported by its essential partners, the body can benefit more fully, including stronger bones, healthier muscles, improved immune function, and better cardiovascular safety. Used correctly, vitamin D becomes a supportive tool for long-term health rather than a hidden risk.